Good afternoon, everyone, and welcome. As I said yesterday, our Phase 1 economic reopening order expires this Sunday on May the 31st. And we are very pleased at how well Phase 1 has gone so far. Businesses, communities, and Missourians across the state have done a great job of implementing health and safety measures. And we continue to be encouraged by data across the state. With that said, today I'm extending the Phase 1 order through Monday, June the 15th. Extending Phase 1 through June the 15th aligns us with our executive orders as well as the state of emergency in Missouri. Additionally, some communities across the state are further along than others when it comes to reopening and economic recovery. Extending the order will give these communities more time to prepare and align with us at the state level as we continue working towards Phase 2. I want to assure you that our efforts are showing positive results. We are still in a good place with all four of our recovery pillars: testing, PPE, hospital capacity, and data. We are extending Phase 1 not because Missouri has taken a step back, but because we want to make sure we are fully prepared for Phase 2. Nothing about Phase 1 has changed. As long as social distancing and other necessary health and safety measures are implemented, businesses can still be open. Events such as graduations, weddings, county fairs, summer schools, and camps can still take place. There are currently no limitations on social gatherings as long as precautions are taken and 6 feet of distance can be maintained. The bottom line is that we must continue to social distance, use common sense, and make responsible decisions to protect ourselves and others. As long as we do this, we will continue the progress we have made with our recovery plan. Speaking of economic recovery, we are excited to announce another business expansion in the state of Missouri. Today, Tooling Tech Group, the second largest tooling provider in the United States, announced a $7.5 million investment to expand its operation in Washington, Missouri by 21,000 square feet. Since 1983, Tooling Tech Group has been a dedicated partner in the Washington community, and we are excited to hear about its expansion project. It is encouraging to know that even in the middle of COVID-19, companies are still investing in our communities. Announcements like these give us hope and confidence as we move forward on the path to economic recovery. I'm thankful for that company's expanding at a time like this, and as I said a couple of days ago, when you realize where we were in January, that things were going so well in our state and we had opportunities for businesses to come here, company expansions, we knew that opportunity was still there. We just had to deal with the virus, and I think now we're starting to see proof that those companies are still interested in Missouri, still the demand's out there. So again, I want to say I hope our recovery process that we go through is going to be on a much faster pace than a normal recession recovery, and I'm still confident that we'll move forward in that in a third and fourth quarter. On the testing front, we will continue to make good progress with our testing plan. From last Wednesday, May the 20th, to yesterday, May the 27th, we have exceeded our testing goal of both sentinel and community testing. For sentinel testing, 6,466 tests were planned from the 20th to the 27th, and 8,127 tests were actually done. The community sampling, 2,550 tests were planned, and as of today, 2,971 were done. We have come very close to our goal of boxed-in testing, completing approximately 4,539 tests in the past week out of a planned 4,670. In addition to our efforts at the state level, Cvs Health Announcement announced today it will be opening 22 drive-through COVID-19 testing sites at selected CVS pharmacies across Missouri. Self-swab tests will be available at these new sites for individuals who meet CDC criteria and state and age guidelines. These drive-in testing sites will be a huge help with our continuing efforts to increase testing in Missouri. We are grateful for CVS commitment to slowing the spread and keeping our citizens healthy and safe. And to wrap things up for this week, tomorrow I'll be on the road. We'll be in St. Louis and Springfield tomorrow. I'll be joining County Executive Sam Page for this Friday's briefing in St. Louis County, and we'll also be delivering some Mass to churches in the area in the St. Louis region. Our next briefing here in the governor's office will be on Monday. Over the weekend, I again want to remind everyone to please be safe, smart, and responsible. We have said all along the social distancing will be a part of our daily lives for some time. This was true a month ago, and it is true now. We have made tremendous progress, and I am confident in the direction we are headed, but we must keep up our efforts. I also want to give a shout out before I finish up to the Beef Month in May for our cattle farmers that were out there. There's been a lot of issues behind the scenes with COVID-19 on the food processing plants that have been in the news with COVID-19 and the testing. But I also want to say this time's been very difficult for our farmers across the state of Missouri when it comes to beef production, when it comes to pork production. Those two industries have been hit hard. They continue to be hit hard in the processing side of it and where they can be able to sell their product. And for most that don't realize what it takes to process something from the local areas, the local farms, even to get livestock processed now, you're probably almost in some instances a year away from getting that done. And we've never seen things moved out because of the demand of that and why we're so far behind in the state. And again, that kind of goes to the national arena where we've had some issues there that I know the federal congressional delegation is looking into that. But anyhow, I want to say to my fellow farmers out there, congratulations on Beef Month. Keep up the good work. We've been through tough times before, and we'll get through this one. So, again, thanks, everybody, for being here today. Dr. Williams is also here to be able to answer questions. Dr. Williams, you got a few words you want to say before we get started? Or you want to go to questions? Come on up, Dr. Williams, then we'll get to questions.
Just to reiterate, incredibly appreciative to all those Missourians that were allowed us to do 5,500 tests yesterday throughout Missouri, and all the people who performed those tests, all those people who had the test in all three areas, our community sampling and our Sentinel and our boxed in. It is incredibly helpful to us, and we are finding people who are positive who wouldn't have known they were positive. If we hadn't been doing that testing, and whether that's in a long-term care facility or whether that's in community sampling or one of our state facilities, we think that makes a difference. We really do. And so we're incredibly appreciative of that. Incredibly appreciative of CVS. As you know, 22 sites, predominantly in Kansas City area and St. Louis and Springfield, picked by CVS and the federal government to make testing available. It's drive-in. You have to get an appointment. You do the test yourself. But that's 1,000 more tests a day, which is just incredibly helpful, so we're thankful to them. And Kelly, I'm happy to answer any questions.
Okay, any questions for Dr. Williams? Hi, Dr. Williams. With the community sampling initiative that you've been doing, do you have demographic data on that? Do you have an idea of who's coming out to do that community sampling and whether it overlaps with the more at-risk demographics like the Black and Latinx communities?
Yeah, for the community sampling, it's all comers. It's just people who want to be tested. It's not a true prevalence study, which we're talking about doing with the University of Missouri, in which we do take that into account so that we can extrapolate from that. So for this, it's really just to offer to those people who want to be tested the opportunity to be tested both for their benefit, which we've exceeded our capacity. Where we've gone, we've had more people who want to be tested who want to be tested. But to your point, it doesn't get us to that granularity, but we will do that. Thank you.
And just a quick follow-up. On May 5th, you put out a whole bunch of information on the website, including some modeling and some predictive stuff. Is there plans to do that sort of data dump again, or was that a one-off?
No, we plan to just keep updating that as we go, and we do that daily. And so, I think the next big dashboard you'll see is economically. We've really gotten our dashboard very robust for health, and I think the plan is to also do the same thing for economic recovery.
Okay.
Thank you.
Hi. You mentioned the antigen testing yesterday. Is there any update on where that's being used?
No, I'm sorry. Not as yet. We just got word that that's being done, and we're in the process of making that reportable as our other testing, and we'll put that on the website as well. And so that is all being done as we speak. Just got word of that yesterday. Thank y'all. Oh, I'm sorry.
I'm hiding back here, I'm sorry. The governor was talking about beef packing plants and the issues they've been dealing with. I'm from St. Joseph, and you're well familiar with what's happened to Triumph Foods. In the last couple of days, I've been talking with employees who have previously tested negative who are now positive, and even those who have been brought to the emergency room. Mm-hmm. We also know that there are 500 or 600 employees there who were never tested. And so if you go off the percentages there, maybe 100 more perhaps positive. What do you do now with a plant like this that is now getting new positives re-entered into the system?
Well, thank you for the question, because to your point, this is not a one-off. This is an ongoing process. And so we were just out at the CEOC meeting just about that, is what will be the rhythmicity of going into Triumph and our other meatpacking plants around the state. We have about, I think, 12 or 13, and doing sentinel testing. And so that would include testing people who are symptomatic, but also picking a certain percentage and in a rolling fashion, just continuously to check them. And at some point, we will probably move that into antibody testing. But I just left a meeting with about 100 people that are looking just at that, and we'll probably be rolling that out next week. And Triumph has been very persistent in wanting to know what that would look like. And so I think we can tell you that next week, how often we'll be doing that testing.
If I could sneak another question in, another Northwest Missouri question. You've talked about testing in nursing homes and other areas for the boxed-in strategy, yes. I guess. Mm-hmm. We are understanding of a nursing home in Gentry County that just had its first death and has numerous cases within the facility. When do you make the decision to go somewhere like there, or have you made that decision, or being aware of it?
I'm not. I just left that, and I know we added 10 more since the original 51 in the last weekend, and that may be one of them. If it's not, again, they are required now by rule to report to us within 24 hours if they have one patient or one staff, and then we go in and work with the local health director.
So through the health department there,
yes.
You would go in for mass testing of this nursing home?
Yes. Anywhere in Missouri, if we have one patient who's positive or one patient or one staff member who's positive, we now go in and work with the local health department and the long-term care facility to recommend our boxed-in strategy. So I'll check on Gentry County when I leave here. I suspect that's one of the ones we added, but if not, we will add them.
If this is a nursing home or another business, how are you made aware of the location? Is it the company that comes forward to you, or is it the health department?
Well, again, thank you for the question. 2 weeks ago, we changed that rule so that the institution, the long-term care facility, or a jail, or a congregate living facility is required by law to report to us within 24 hours. Before, it was the provider. It would have been the doctor who did the test. But now, as of 2 weeks ago, we require the facility to let us know, and that triggers a very robust response. The governor has mentioned this numerous times, is that when we look back at our mortality and our morbidity, sadly, so much of it is concentrated in our long-term care facilities. Now, because we've so purposely worked to build up our testing capacity, and we'll now be to 10,000 tests a day now that CVS has come up on board, we're going to use that to get in there as quick as we can and box it in.
Appreciate it. Thank you.
You're welcome. Thank you.
Thank you. Let me just make a comment. I know whoever was up there from Northwest, I don't know who's asking those questions, but one thing we want to do, we want to do as much testing as possible. So we want to provide those services up there. I think it's also important to remember when all the counties were distributed money across the state of their initial round of the CARES Act, that money can all be used on the local level for testing also. So we're going to be encouraging that. You'll see Director Dixon in here next week, probably speaking a little bit on the economy and really figuring out what we can do on the business sector on the testing side also. But we want to encourage those local levels, that money they got, to be able to utilize that for testing as we move forward. So questions?
Just on keeping the state in phase one of this, you said that there are some communities that aren't as far along as some others. What are those communities, and really what would you like to see those communities do, and what kind of level would you like to see them get to before we move into phase two?
Yeah, I think every day, and you got to be looking at the data that we look at. Like just we'll just go in the briefing, you heard about a nursing home in a different part of the state that we haven't done before. So we need to really keep an eye on those things like that. You still have the St. Louis region, the Kansas City region. That's not as far along as a lot of the other parts of the state. Springfield, for example, Columbia's did really well, but they're ahead of those two on that. So one of the things as we've been moving forward to this, I've been talking to the mayors, county executives, county commissioners across the state that we're talking to them, trying to figure out how we can kind of narrow our questions down, or narrow the order down to where we're all on the same page. So with the average Missourian out there, when they go somewhere, they can feel like they can do about whatever they need to do wherever they go, and they're not trying to figure out whose guidelines are whose. So that's another thing we're trying to get in line to open the state up more. But look, we got to continue to open the state up as we move forward.
And a quick follow-up on that, did the videos and pictures from the lake this weekend have any bearing on your decision to keep the state in phase one?
No, it really didn't. We were pretty well along the way on making this decision. Again, I think Memorial Day weekend for the whole was our first major weekend. We want to see how all that comes out. We want to see how everybody was. But again, the thing at the Lake of the Ozarks is a very, very, very small sample of what was going on in the state. And for the most part, people were doing their part, and I think they're going to continue to do that. I'm confident of that.
Hi, Governor. Do you have a sense yet of what phase two will look like?
Well, it's going to be more open. I mean, we're going to be finding out to the point where at some point we got to get out of the phases, we got to get out of the orders, and we got to get people back to work. That's the key to moving forward and be able to do it safely. So I think that's one of the things we got to do. But we got to start preparing ourselves for that. We got to start preparing ourselves that we're going to have to live without an order, and nobody's going to have to tell everybody to do social distancing. We're going to have to take it upon ourselves to do that and kind of reiterate that from time to time. But, in the very near future, I hope the state is open back up for business at all angles of that. I hope there's sports back there. We're just going to have to be cautious of how we conduct ourselves. But we're just going to move forward at a time. So June the 15th, we'll make another decision.
And separately, just given the recent history of our state here, do you have any thoughts on the death of George Floyd and the violence that was seen in Minneapolis last night?
Look, I was in law enforcement for a long time, and you see what's going on in other cities. You never want to see that. I don't. And I think I've always held myself to a higher standard, whether I was in law enforcement, whether I was in the military, whether I've been a legislator, whether I'm the governor now. When you get in those positions, you got to be held to a pretty high standard to how you conduct yourself. And look, there's times like that what I know from the outside looking in probably wasn't the best of circumstances, and people have to be held accountable for that. But again, I want to be really careful where I judge somebody because of just what I've seen on TV, because I don't know what the facts were and everything. But, as a normal person, it didn't look too good to what happened there. And by all means, law enforcement, I prided myself in that forever. Your job is to take care of people, not to hurt people.
Governor, you mentioned a couple of days ago that it's local health departments' responsibility to enforce social distancing orders. The Springfield News Leader has reported that counties in the Lake of the Ozarks area, are saying that it's up to the state health department to enforce those orders. So we've gotten an almost impasse where no one is enforcing the order. How do you propose to break through that impasse or a resolution?
It is what it is. The local health departments, for example, shuts down restaurants when they're not doing something right, when they're not clean, when it's not healthy. The state don't come in and do that. They do that. That's their job to do that. Look, I've been a supporter of local control ever since the beginning that I've been here as governor. I'm telling you, the local control sometimes needs to take the responsibility, good and bad. And that's the way it is. And I kind of said that the other day. I don't like the federal government in here mandating what I do as governor of the state of Missouri. And that's why people get elected on local levels. We've said again, the health department, we issue guidelines for the local health departments. The avenue, the local health departments of the statute, I don't know what statute number is, but they would go to court. They would file with the court, with the judge. A judge would then do an order, and then you would enact that order, whether that be through whatever means he decides to use, whether that's pulling a business license, whether that's like anything else. COVID-19 has caught a lot of attention, but at the end of the day, the rules are in place that were in place before that, and they currently still are. Just because COVID-19 doesn't change it.
Governor, you have the state health department does have the ability to enforce the social distancing order according to the order. Is it a philosophical difference as to when they should use those enforcement abilities?
I will answer that like I did the other day. You can make an order that we keep 6 foot distancing. There's nobody going to be out there from the state level monitoring who's 6 foot away from each other and who's not. We're not going to do that. It's a recommendation for people to follow is what it is. But again, I'm not going to send some sort of police action out there to enforce whether somebody's 6 foot apart or whether they're not. I think that's a dangerous road to go down when government has that kind of authority over individuals anyhow.
Going into Medicaid expansion, the hospital associations worked with the state in its response to COVID-19. They also supported the Medicaid expansion ballot initiative, and they said that, and other researchers have also backed this up, that Medicaid expansion helps hospitals stay open. It brings in more revenue. States with expansion have more rural hospitals stay open than states that haven't. Do you find that argument credible, or do you think that the costs outweigh the benefits?
There's no doubt that the expansion is probably it's to the advantage of the hospitals. There's no doubt about that because they're going to be seeing the patients and they're going to be receiving the funding from that. The end of the day is what is the taxpayer willing to pay for? Because when you expand Medicaid, if you put, for example, I think one of the theories I said, and again was about 200,000 people to add to the rolls, it's going to cost a lot of money to be able to do that. So, first of all, I want to be clear. I appreciate what the hospitals do every day, and I appreciate what they did in COVID-19. But I will say this: that they really have a reason to be involved in the passage of Medicaid due to financial reasons. And I think I don't think that's any secret. But I think you also got to look at the whole picture when you decide whether you're for Medicaid or whether you're not, and what that really means for the state and what it means for the taxpayers of the state.
And just a quick follow-up on that. So right now, as the status quo goes, the state covers around 35% for people who are covered with Medicaid when they go and use their coverage. Under expansion, it would be 10%, I believe, and the federal government would pick up the rest. So how does that fit into the argument about it costing more?
Well, first of all, you can't take the 65% that you're talking about and shift that over to the 90%. That's one of the little misleading things they talk about. Kind of what you just said right there. People want to say, okay, well, it's only going to be you're going to get 90% where it was 65. You can't legally take those people that are at 65, 35 and move them up to the 90% category. You can't do that. That will be for the new people coming on in the program. And the federal law won't let you do that. So that point needs to be pretty clear. That's why, it's going to cost more money.
Governor Parson, how confident are you in the state's healthcare system to keep up with any new cases, any new spikes in cases of COVID-19 as you continue to reopen the state more fully?
Yeah, extremely confident in it. Again, it's just incredible what the healthcare has done in this state of Missouri during this time. I think right now, the last numbers I've seen, we're probably somewhere around 600 in hospitalization right now that are in there, less than 100, I believe, on ventilators. So all that's good news compared to where we were. And I think we've got the capacity for over 2,000 ventilators. We got some in stock. We're much more prepared now than we was. But I don't think, I hope, we're not going to see any kind of numbers like we first seen when it took off and we wasn't prepared for it. We're much better prepared for that. But the hospitals are in good shape. We know we still have a temporary hospital out there. We know we can go to different parts of the state now, and within 10 to 11 days, we can put up a full-blown hospital. So that's a little comfort to know that can be done. And again, my hat's off to the hospitals and the healthcare across this state for what they did during that time, and you can see how quick they can move and how quick we can do things we have to. But again, I think we're well prepared for that if it happens, and I think we're all watching that daily.
Hi, Governor. In a legal filing, this has been reported that lawyers for the Cedar County Commission and the Cooper County Public Health Center said that your social distancing order contradicts the state's interpretation of a measure that you signed in 2019 that bars counties from enacting health rules on agricultural production. So just wanting to see if you have any comment on that or stand by that.
I don't have any idea exactly what you're talking about there. I think you're going back to the CAFO deal back in 2019. Is that what they were talking about, those two counties? Yeah. And I think that's a totally different argument what we're talking about today. You know, you're talking about CAFOs back then. We're talking about health care for everybody today. You know, an order's an order. We did an order, on that. So I'm not sure that's a very fair comparison of what we're talking about today.
Governor, there's going to be municipal and local elections all over the state June 2nd. Do you plan on voting in the local elections, and are you going to go in person?
I don't know whether I'll go in person or absentee yet. I'm not for sure, but I'll plan on voting in it, if at all possible, if I can.
Okay. And is there any message that you have for Missourians who are contemplating going to vote in person on Tuesday?
Yeah, I hope they get out and I hope they vote. That's one of the most important things we can all do is to vote. I think most of your elected officials that I know of across the state, I think they're well prepared to know the situation, and I think they're going to make that as safe as anywhere else you go in the state of Missouri, whether it's some other business or that. But I'm confident the counties and the local elected officials understand what we're up against here, and they're going to be, above all means, they're going to be making sure it's safe that's there. I think Secretary of State was out a week or two ago, to almost every polling place in the state, making sure they had equipment there, making sure they were prepared when this vote comes. So, I hope people feel safe, but to go out and vote. But if they don't, the number one thing is their safety should be number one. So if they don't, then don't go out and vote. I don't know, like I've ever heard myself say that, but if you didn't feel safe, then I wouldn't do that. So, but I hope people feel safe enough to go out and vote. Those elections are important. They're important for what happens down the road, as we all see right now, what elected officials on the local level are doing and how important it is to make sure you got the right people in the right place.
Just one quick little follow-up. You mentioned that you can't transfer over current Medicaid recipients to that 90% rate from the 65% rate. If more people are going to be qualifying for Medicaid because of the job losses that we've seen and the loss of income, isn't it preferable to have that 90% rate rather than the 65% rate if you're adding people to the rolls with or without expansion?
If you're at it, well, you'd want it to be as high as you could if you're going to expand it. Sure, if you're going to get 90% for them, if you expand it, you sure want that if you can get it, yeah. I don't think there's any doubt about that. So if it gets implemented, for those, it's good. But, the whole point of it is, and there are going to be a lot of people, pros and cons on this, but, I just think it's important for people to understand really what the expansion is and really what it is Missouri does, to know all the details in that, and then make a decision. But people will figure that out. There'll be a lot of propaganda on both sides trying to influence people how they vote on that issue. But at the end of the day, this is what I do know. I don't know of hardly any program that I could name to you, and I've seen a lot of them, that when government expands, it gets less expensive. That's going to be a hard argument for me to ever believe that anytime you expand government, things are going to get cheaper or we're going to save money. I haven't seen that happen. Government's not very good at doing that either. I do know that.
Thank you, Governor. One more question regarding Triumph Foods. I apologize, but there are employees who had tested negative who are afraid of going to work, and some of them have come up positive. They have organized a Change.org petition with 5,000 signatures on it now. We know the presidential declaration. We know the importance of the meat to the food supply. Yeah. What do you tell these employees who are afraid to go to work every day? I think we need to do as much as we can to educate the employee to know what the risks are.
and how we can test for that. I think you brought that up earlier with Dr. Randall's. If testing is what makes everybody feel safer, is why we're doing it in a much larger number, that's what we want to do. We want them employees to do everything we can that they feel safe when they go to work. And whether that's the PPE gear they might have, whether that's the testing that we might have, or whatever we can do as far as distancing goes, working with a company or something. But at the end of the day, I don't think any of us want any employee to go to work in an unsafe condition. So I think it's the employer's job, along with ours, to make sure that it's safe as we can make it. But people's got to go back to work. I don't know that you can just necessarily say, I want to stay home without some reasonings behind it and totally understanding what the risks are. I think it's a job on us to make sure they understand that. And then they have to make a decision whether to go to work or not, like everybody else.
Thank you.
All right, thanks everybody.